It's that time again, Our Town Live, where friends, family, people you know, and others you'd rather not know share with us their unique bits of wisdom. And now, here's Herb, your host, for another show.
Kevin Rouhlac and his partner Kirk Stewart opened the doors of Inmotion hand and physical therapy in 2007, a rehab environment that was patient-focused, fun, and provided quick, effective results. Since that date, they have added several new programs, staff, and have gotten hundreds of people back in motion after injury. In 2011, they opened their Woodstock, Georgia office. These two locations have successfully recreated the same patient-focused and fun environment that they have found their patients enjoy and also seem to thrive in while recovering from injury. They realize that with your active sport, work, and leisure activity, injuries are many times unavoidable. They thoroughly enjoy watching their patients get back to the lifestyles they do enjoy. This is why they operate under the motto, Your Rehab Our Passion. The patient's care and satisfaction is a priority at Inmotion Hand and Physical Therapy. Each of their locations provides you with a warm, friendly environment and extended hours for those who need appointments before or after work. They also provide free, convenient parking. Let's meet Kevin.
I am the president and co-founder of Inmotion Hand and Physical Therapy. We have been in business since 2007. Opened our first office in Alpharetta, Georgia. I got into an interest in physical therapy after playing college football at Florida A&M University, where I got hurt a little bit and started going to physical therapy myself. After that, I got really interested in the field and pursued the field. I have worked in physical therapy since 1998 and have enjoyed the field and enjoy helping people. As a company, we have two offices and are looking to expand and grow. Our plan is to open two more in the next year, and that's where we are now.
Tell me, what is your education in physical therapy?
So the clinic, we both see both patients that are occupational therapy patients as well as physical therapy patients. I am an occupational therapist with a certification in hand therapy.
You mentioned we. Who's the other we?
The other we is my partner, Kirk Stewart, who is a physical therapist.
What actually is physical therapy?
So physical therapy is a process where you have someone who is unable to complete their activities of daily living or their ability to mobilize from one place to another. The role of physical therapy is to help people to get back to doing the things that are important to them, whether it's walking from A to B, whether it's running, sprinting, throwing a ball, being able to make your bed, driving your car. So we take people from a place of them being a bit incapacitated, whether it's post-surgery or whether it's a injury that they've acquired, to take them back to being able to do those things that they need to do to assume their regular lifestyle.
You mentioned that your specialty was hands. What makes a specialty?
My specialty in hand therapy. So in hand therapy, people specialize in hand therapy because the hand is a very complex and detailed portion of the body. In order to acquire or become a certified hand therapist, we're required to not only have a degree in occupational therapy or physical therapy, but we also have to have 5 years of experience. I think that's when I became a hand therapist, you had to have 5 years of experience. I believe those years are 3 years now. But you also have to pass a specialized board exam. And then once you pass that specialized board exam, you become a certified hand therapist.
Can I be doing myself a disfavor by going to a generalist instead of a specialist?
You can. The CHT ensures that that particular therapist has an acquired amount of time that has been dedicated to working with the hand and upper extremity only, as well as pass the rigorous board exam. There are therapists who treat hands, however, without them having the certified hand therapist label. You really have no way of knowing how much experience they have in that particular area of the body.
Could I be unintentionally lengthening out my therapy sessions by going to somebody that isn't a specialist?
Yes, you could definitely lengthen your therapy, and you could also, depending on what the diagnosis is, you could also cause yourself a bit of, put yourself at risk, I'll say, of not improving at all.
What do you feel when somebody is told by their doctor that they need physical therapy? When trying to find one, even if you get a good referral, do you think you should get a second opinion from others before you start with one?
Not always, but I do believe that with technology today, you're able to go on to Google and do a bit of research for yourself.
For full disclosure, I must tell everybody that you have been my physical therapist on my bum shoulder for a year, and I highly recommend you.
Thank you, Herb.
Now, what actually happens in a therapy session?
Okay, your therapy session, the first day in the therapy session is about gathering information. You'll stop by the front office and you'll give the front office staff your various information regarding your insurance. We need to make sure that with your insurance that you are in network so that your services are paid for. Then from there, you go and visit the therapist. The therapist on day one's goal is to find out information about you, what happened, when it happened, how it happened, if you've had surgery, when the date of that surgery was. And the biggest question and most important thing for me is to find out what that person's goals are, what they want to accomplish in therapy. And then after that, we go into our portion where we take our baseline measurements. And we compare that baseline measurements with whether it's national averages or if we compare it to the other side of the person's body, which isn't injured. And then once we collect those objective measurements are revealed to the patients, and then together we set goals. Those goals will be short-term, what you want to accomplish short-term, and then longer-term. And the goal is always, though, to rehab somebody to the point that they can do the things that are important to them. Some people, the most important thing is for them to be able to lift a child or a grandchild. But currently I have a couple high-level pitchers. You know, their goal is to be able to go back and throw a 90-mile-an-hour fastball. So those rehabs in the beginning look the same, but towards the end they start to look a little bit different.
Tell me, what's the difference between physical therapy and occupational therapy?
The difference in physical therapy and occupational therapy. In an outpatient orthopedic setting, the physical therapist generally is in the goal writing. Physical therapy's goals will be how you get where you need to get. Occupational therapy's goals are going to be how you do what you need to do. Also, in an outpatient orthopedic setting, you'll find more often than not, the occupational therapist will be the person who is specializing in upper extremity, whereas the physical therapist will be the person that will be specializing in lower extremity, back, and some of the more general things. That differs a little bit when you get into a hospital setting. In a hospital setting, you'll have the occupational therapist is much more detailed, concerned with activities of daily living, such as how you dress, how you get in and out of your car. And with PT, it's about mobility, how you ambulate from place to place, how you transfer from one surface to another. A lot of gray area in between those two, but there's some differences.
Why do I have to do certain exercises that you make me do when they make me sore?
The reason why you get sore with certain exercises, so most people come to me, and Herb, since we're talking about you and I, when you came to me, your tissue, had some atrophy. And then an important thing happens when a person is immobilized post-surgery. And regardless of the body part, when a person is immobilized post-surgery, the tendons and ligaments, the ligaments that attach bone to bone and the tendons that attach muscle to bone, they shorten. And one of the goals will be to increase range of motion. The only way to increase range of motion is to lengthen those structures again. Now, the human body sometimes doesn't know the difference in injury or versus us lengthening those tissues. In the process of lengthening tissues, you actually have to break the tissue down a little bit, similar to when you're having to lift weights. And when that happens, your body sometimes responds similarly to an injury. We try and control that with various modalities, such as ice, such as electrical stimulation, but that does still lead to some soreness when you're stretching a tissue back out.
Another personal question. Why does physical therapy take longer than I thought it would?
I think that physical therapy generally takes longer than not just you, Herb, but most people. And I think because on the front end of when you go and visit your doctor or your surgeon, I think there's a little bit of a informational gap that doesn't happen when you have your surgery. And a lot of surgeons kind of lean on us to be the educators in that realm. Most of us think that we're going to go and have our surgery, and shortly after that, we'll be fine. However, most times than not, that isn't the case. Sometimes it's 3 months, sometimes it's 6 months, and as you know, Herb, sometimes it's a year, depending on the severity or complexity of the surgery. Herb, can I talk about you a little bit?
Absolutely, please.
You had one of the more complex types of surgeries when you have a reverse shoulder replacement. And typically people get reverse shoulders as kind of a last-ditch effort to try and relieve some pain in an area that is typically really stubborn. Then, there's a little bit of a complication in your case where that happens with people sometimes. You ended up with a small crack in your acromion and had to lay off for a while. In a case like that, then there's also a period of time where you have to rest. And in that period of time you have to rest, the tissue is shortening. And then once that's healed, we have to go all the way and lengthen those tissues again. So all in all, the months start to add. 1 month starts to 2 months, adds to 3 months. And then we also take into account that we have something called protocols. And what protocols are kind of like recipe books for rehab. Within certain periods of time, we're only allowed to do certain activities so that the tissue heals. And then when that time's up, we get to progress and move forward a little bit. And in some cases, those protocols extend out 4 months. In your particular case, Herb, your protocol extends out 4 months, and then you had a little bit of a complication, which extended things a little bit longer. But in general, I think people don't take into account how long it will take for them to recover from an accident or surgery.
Do I really have to do home exercises?
If you want to get better, you definitely have to do your home exercises. In general, especially with the way insurance is now, most people get therapy 2 to 3 times a week. Most therapy sessions last an hour to an hour and a half. And just for example, if it lasts an hour and a half, and if you're coming twice a week, and that's only 3 hours